This all links to the preparedness platform in our common agendas. Pandemic, early warning or pandemic preparedness, but it speaks to the wider issues of all the health-related negotiation tracks in this General Assembly.
Good afternoon, and it is my honor and pleasure to introduce this session on the need for a global early warning system for future pandemics.
I'm Dr. Nivo Hara. It's an honor to be here. Thank you to President Koroshi and Your Excellencies.
Really, I was surprised and dismayed about how unprepared our institutions and our societies were for dealing with an emerging pandemic. It highlighted again for me how disconnected institutions were, but it also highlighted for me how interconnected everything in the world is, whether it was populations, human health, supply chains, manufacturing, travel.
COVID-19 pandemic made pandemics a reality for us. As a society across the world, this was our first shared experience of a pathogen. And it meant that we directed considerable resources into building infrastructure around pathogen surveillance. We are in a much better position to anticipate the next outbreak and pandemic. And part of that is due to this infrastructure that we've developed. At Biotia, we recently launched the Pathogen Watchtower program. And under this program, with support from the Rockefeller Foundation, we've funded 12 organizations across the world, 8 countries, 4 continents, who are using genomics in biosurveillance.
I think that one has to look at the climate change question as part of a panoply of human actions that are transforming the planet. So when we're talking about climate change, we're talking about changes in weather patterns, temperature regimes, climate systems are shifting around. These different dynamics interact with other factors that are going to be connected to the disease question.
Dr. Freitas is studying dengue fever, and what we see there is that there's a strong relationship between dengue and climate changes. As the earth gets warmer, there becomes greater habitat for dengue-carrying mosquitoes. What we're hoping to do with Dr. Freitas and with Geoseeq is combine climatological data that will tell us the long-term trends of how the earth is warming, how the climate is changing, with meteorological data, short-term weather trends that are going to tell us things like how active are mosquitoes in a given day, with genomics that are ultimately going to tell us what diseases these mosquitoes might be carrying.
Among all diseases, more than 17% of them are transmitted by vectors, primarily mosquitoes.
And I would say that the biggest challenge of my work is to merge different kinds of information, like information regarding the mosquitoes, information regarding the climate, the environmental, the satellite images, and epidemiological information. And we need to merge all this information to have an effective and robust model that can explain transmission risks. And of course, this would be like a very powerful tool to develop early warning system, which is the main objective of our scientific collaboration.
So one of the challenges we see with current surveillance efforts is that they will focus on a specific pathogen in a specific region. So the vision for Geoseeq is to transcend borders, work together to share data, and not specific to one pathogen.
My colleagues in Pasteur Network, Asia Pacific region, and I recently initiated a pilot project to investigate antibiotic resistance in community through genomic analysis of samples collected from the public toilets in several cities in Asia.
Many researchers in the field, they want to see certain things, but since they don't have enough knowledge or skill sets to look at the genetic information. Geoseeq at this point is a great platform for people to look at the genomic information in the whatever species they want.
The information that came from Israel during COVID was extremely important, especially the quality of the digital health records that were used for both understanding outcomes, comorbidity, and vaccine development. Those are the kinds of data that we need to make available to everyone in the research community.
So the vision here for Geoseeq is to take that triumph of science that we saw during the pandemic and extend that to other pathogens.
And so really my vision is an open source, philanthropic, data sovereign, global community modeling platform that informs policymakers around how to detect, prepare for, predict, mitigate, respond to emerging infectious disease.